Good morning, and I apologize for being late. It was me and not Marion. This morning we'll give our update about the COVID-19 situation in PEI and the country, and also focus on vaccine rollout. There are no new cases of COVID-19 to report in PEI today. We currently have 8 active cases and 160 cases since the pandemic began. We received confirmation from the National Microbiology Lab and our provincial lab that 2 of our previously announced cases were the B.1.1.7 variant, originally detected in the UK. Both of these cases that were announced on March 26th related to travel outside of Atlantic Canada, and they tested positive on routine testing and entered self-isolation upon arriving in PEI. Canada surpassed the 1 million case mark on Saturday, and as of yesterday, there are 1,014,373 cases and 23,118 deaths. In the past 24 hours, 6,267 new cases of COVID-19 have been reported in the country. Over the past week, there has been a 25% increase in the number of new cases reported in Canada. The situation in other provinces is very concerning. As a country, we are experiencing the 3rd wave of this pandemic, as evidenced by elevated disease activity. The variants of concern are becoming the dominant strain of infections in many jurisdictions. The surge in infections is being driven by 2 variants, B.1.1.7, associated with the UK, and the P.1, associated with Brazil. The variants of concern are more transmissible, they result in increased hospitalizations and deaths, and are having a disproportionate impact on younger people. The disease pressure is shifting to younger age cohorts, with the rate of new cases being highest among those aged 20 to 29 years of age, followed by those aged 30 to 39. Because the variants are causing more severe and critical illness, many provinces are dealing with a worrisome trend of increased hospitalizations and ICU admissions. Healthcare systems and healthcare workers in many provinces are under renewed strain. We have great empathy and concern for the many healthcare workers and first responders who are working tirelessly to care for the many Canadians with COVID-19 who require hospitalization, especially the hundreds of patients who are critically ill in intensive care units. We know the basic public health measures work against the variants. Physical distancing, hand washing, wearing a proper fitting mask in public places, keeping your circle of contacts small, and staying home when not feeling well are effective measures against the original strain of COVID-19, and they are also effective against the variants of concern. As a country, we are in a race against the variants. It is important we continue to immunize Islanders against this virus as quickly as possible. As of Saturday, 27,448 doses of vaccine were administered to Islanders. This week will be our largest week yet in terms of administering vaccine. Our plan is to administer a total of 7,200 doses this week, or an average of 1,200 per day over those 6 days of clinics. In addition, home care will also be administering doses of vaccine to individuals. As I mentioned, we need time to roll out our vaccine plan. There will be enough vaccine for everyone who is eligible and who wants a vaccine. Everyone is important. Our goal is to immunize all Islanders with 2 doses of vaccine, and we are on track to do this by the fall. 1 dose of vaccine provides good immunity and protection from illness and hospitalization. However, it is only when we get our 2nd dose and achieve a high level of immunization as a province that we will be best protected. I spoke earlier about the increasing strain of the P1 variant in some parts of Canada. It is not known at this time how and if the vaccine is effective against this strain. Thank you to all Islanders who have already been vaccinated and to the many others who have booked your appointments. The response from individuals and groups of Islanders to the opportunity to be immunized has been very positive, and thank you all. Each person that is one of us that is immunized benefits the entire province. We are aiming to achieve herd protection by having 80% of our eligible population immunized with 2 doses of vaccine. We will achieve herd protection one person at a time, one immunization at a time. As a province, for us all to be protected and to be able to change our broad public health measures, we will need more people to be vaccinated. So until we achieve this, we will do our best to continue to protect Islanders from COVID-19, and that includes all the things that we've been doing: border measures, self-isolation, testing. I'd like to remind those who have been vaccinated or the groups of Islanders that are booking vaccine appointments who already has been vaccinated. So residents and staff of long-term care and community care, many frontline healthcare workers involved in the COVID-19 response, first responders, those living in congregate living settings, other healthcare workers, many healthcare workers at Health PI, and 80% of those age 80 years of age and above have already been vaccinated. Rotational workers and truck drivers have been contacted to arrange appointments. We know our populations, First Nations and Indigenous, have also had vaccine clinics. Islanders age 65 and older have started making their appointments, and those age 60 to 69 with underlying health conditions have also started scheduling their appointments. And starting this week, and Marion will have further details, those age 60 to 64 will be able to start booking their appointments based on the month that they were born. As well this week, those age 40 to 59 with underlying health conditions will also be able to book their appointments. Healthcare workers who work in the community, physiotherapists, optometrists, occupational therapists, who work directly with the public will also be able to start booking appointments beginning next week. Frontline workers will also be able to start booking their appointments next week for those initially who are age 40 to 59. On the website today, there will be an outline of the schedule as we go forward. So as I mentioned, next week, adults age 50 to 59 will be able to start booking their appointments. And then by the end of the week, those age 40 to 59 who are frontline workers who are interacting in person with the public and who cannot work virtually will be able to start booking their appointments. And that includes teachers, early childhood educators, school staff, including bus drivers, public transit drivers, telecommunications, food manufacturing and processing, as well as those age 18 to 39 with underlying medical conditions. Again, this will be for next week. The week of April 19th will be adults age 50 to 54 and other frontline workers age 18 to 39. The week of April 26th, adults age 40 to 49 will be able to start booking their appointments. And week of May 3rd, adults between the ages of 30 and 39. And the week of May 10th, adults age 16 to 29. So I think that we're hoping that that will be helpful with more of those details laid out on the website as we go forward. And every week we will speak in more detail about those groups. As well, beginning this week, the AstraZeneca vaccine will be available in 12 partner pharmacies for anyone over the age of 55. For instance, if someone wants to get the AstraZeneca vaccine, they may be able to get an earlier appointment by booking at a pharmacy. Alternatively, they can wait to get an appointment at a public clinic where the Moderna and Pfizer products are being administered. This approach is in keeping with similar use of AstraZeneca across the country, including other maritime provinces. And this may be an option for anyone who wants to get their vaccine earlier. In PEI, we are currently immunizing Islanders against 15 different diseases, including COVID-19. Very rarely an individual has a serious reaction to a vaccine, including anaphylaxis. And in PEI, we report 1 to 2 serious reactions relating to anaphylaxis per year, and that's based on the thousands of vaccines we give in our normal vaccine programs. And regardless of where you receive a vaccine in PEI, the staff are trained and prepared to deal with a serious reaction such as anaphylaxis. The reason you are asked to wait in an observation area after receiving a vaccine is to ensure you are not going to have a serious reaction to the immunization. Canada has a very robust surveillance system for reporting and monitoring adverse reactions to immunizations. PEI, like all other jurisdictions, is legally required to report all vaccine-related adverse events, including serious reactions, to Health Canada. The surge in new cases of COVID-19 in Canada, including Atlantic Canada, is an important consideration regarding the planning of the Atlantic bubble, which is scheduled to reopen on April 19th. Ultimately, the decision regarding the reopening of the bubble will be made by Atlantic premiers. Public health officials and our epidemiologists have identified a number of key benchmarks to be considered when planning for the Atlantic bubble. Overall low case counts in the region and containment of outbreaks, and specifically the number of cases in the region, including unlinked cases and outbreaks, the prevalence of cases related to variants of concern, and geographical spread of cases between provinces. COVID-19 is spreading between provinces by travel, both domestic and international. We have said before that COVID-19 moves when we move, and that PEI is at high risk of importation of this virus. This is more of a risk as the country struggles with the variants of concern. At this time, unnecessary travel or travel for unnecessary reasons is not recommended, regardless of your vaccine status. I was reminded over the Easter weekend how different our COVID-19 situation is in PEI compared to many other provinces and jurisdictions. We are able to gather with a small group of family and friends to celebrate the Easter holiday. We were able to enjoy most of our traditions and activities with some modifications. At this point, we are in that enviable position, having a low number of cases and no evidence of community spread of COVID-19. Islanders should continue to follow the public health measures and be tested for COVID-19 even if they have mild symptoms. The increasing prevalence of variants of concern in Canada underscores the need for individuals to be tested. We want to detect cases as early as possible to prevent the spread of this virus in PEI. I know the Premier has made references to hockey over the past year, and the game is not over, and we need to keep our sticks on the ice and wear our protective equipment. And recently, someone mentioned that we need to continue to steer a steady ship, and that is especially true as we see potentially some turbulent seas and big waves ahead of us. So as we face these stormy seas, the vaccine is the hope on the horizon. I mentioned earlier that we need time. We need time to get more people vaccinated, and I ask Islanders to be patient and kind as they wait their turn to be immunized against COVID-19. Thank you.
Thank you, Dr. Morrison. Good afternoon, everyone. As Dr. Morrison mentioned, this week our vaccination clinics are scheduled to immunize over 7,000 Islanders. These clinics have been going very well, and I want to offer my thanks to all who have been cooperating with our booking process as well as working at our clinics as both volunteers and staff. We remind Islanders to show up at your scheduled appointment time for clinics and not too early for your appointment to avoid congestion of people at our clinic entrances. This week, we are booking individuals aged 60 to 64 based on birth month, and those began yesterday. So as of today, April 6th, anyone aged 60 to 64 born from the months of January through June are able to book their appointments. Tomorrow, Wednesday, individuals born in the months of July and September can book. And Thursday, April 8th, individuals born in the months of October through December can book their appointments. Today as well, we will begin receiving online appointment bookings for people who provide public and private healthcare services in our community, including clinicians and clinical support staff. This group includes providers such as optometrists and optometry clinic staff who work directly with patients, physiotherapy, occupational therapy clinicians and staff, and any other healthcare providers who are in a clinical setting working directly with patients. As noted previously, dentists, dental hygienists, and dental assistants working directly with patients have already been eligible to book their vaccine appointments. On Friday, April 9th, people aged 40 to 59 with underlying medical conditions and any household members will be able to start booking their appointments as well. Dr. Morrison reviewed the schedule that will be upcoming for booking appointments, and that will be released out on the website this afternoon. So people will be able to refer to that. But just as a reminder, beginning Monday, April 12th, it will start our group of Islanders aged 55 to 59 years of age. And those Islanders will be able to book again according to birth month, and it will be broken into thirds next week. So I'll ask people to refer to the website for those details. On Thursday, April 15th, those bookings will open to additional groups, the frontline workers aged 40 to 59 who are interacting with people, members of the public who can't work virtually, and those aged 18 to 39 with underlying medical conditions. Appointments can be booked directly online using our online booking system at princeedwardisland.ca/getthevaccine. This is the quickest way to book an appointment, and it is very easy to use. Those who aren't able to book online can call our appointment booking line to speak to a clerk. The number is 1-844-975-3303. And a few reminders today that you must have a booked appointment to receive a vaccine at our clinics. People have been accompanying their spouses to their booked appointments and expecting to be vaccinated, but only individuals with a booked appointment are able to receive the vaccine at our clinics. I want to thank everyone again for booking their appointments and getting the vaccine when you're eligible. Thank you for your patience, for waiting for your turn. And as we see more cases of COVID-19 and the concerning variants across Canada, we know getting vaccinated will play a major role in limiting the additional cases here in PEI and avoiding that disruption to our relatively stable lifestyle we've enjoyed. As always, please continue to follow public health guidance, wash your hands, wear a mask, and keep your circle of contact small. Thank you.
Thank you, Marion, and we'll open it up for questions.
Wayne Thibodeau, CBC.
Good morning, Dr. Morrison, and good morning, Marion. Marion, I just wanted to ask a bit about your comments that you made about unnecessary travel not recommended. I know we're seeing just moments ago Premier of Nova Scotia Ian Rankin and Dr. Robert Strang announcing that they're opening that province to Newfoundland and Labrador, and now anyone in Atlantic Canada can travel to Nova Scotia. So even though we're all here on the East Coast sort of in a similar situation, we seem to be seeing a difference in policy between PEI and Nova Scotia. Can you explain why that might be the case?
Hi, Wayne. Good morning, good afternoon. So, I mean, I know Nova Scotia has always, even since the fall when things changed with the Atlantic bubble, have at various times, based on their epidemiology, not required the same isolation when you go to Nova Scotia from New Brunswick for a while, and then that changed. The same was for PEI, and then they had that initially for Newfoundland, and then because of the outbreak there, they had changed it, and they're changing it back. So Nova Scotia has been a little bit different in terms of their approach to requiring others from the area to isolate on entry to their province. And I think that's the goal certainly for us as we go into the Atlantic bubble in on the 19th, if that's what I know is being planned, that there would not be the requirement for others from within Atlantic Canada to isolate within travel in the region. The Atlantic bubble has worked it worked last summer and into the fall for about 5 months because the numbers of cases and our epidemiology really supported that. And we're hopeful that that will be able to happen again. And I know many are anxious to have that happen. I also recognize there are a number of people who are concerned about what could happen when the Atlantic bubble opens. And I think that's why we'll continue not only to look at that epidemiology over the next week on a daily basis, but we'll continue to look at it even after the bubble opens, so that if changes are required, we'll make them. So I think it's not that, I think all of us in all our provinces and in the region, we're trying to do the best we can to protect our populations as best we can from a virus that is increasing elsewhere outside the region in particular.
Thank you. And just following up on that, you mentioned the Atlantic bubble. I know we're seeing thousands of new cases in Ontario. I mean, it seems like things are going off the rails in some areas of the province. And I know you mentioned before this really is a day-by-day decision. But based on what we know now, is the province still proceeding with plans for the Atlantic bubble on April 19th?
I know that our epidemiologists are meeting, not just here in PEI, but our epidemiologists in the region are meeting and making sure that they have an up-to-date report to us by next Monday based on the information over the next week that will be discussed amongst the Atlantic chief health officers, and then that information also then going to our premier. So it is, the kinds of information, I think we've talked about it, but looking at how many cases per day over a rolling average of so many days, we've talked about some of the criteria that epidemiologically they're looking at. So I think the area of concern, of course, is part of northern New Brunswick that has had more cases, but we are going to see where we are within a week and give that best advice that we can to our premiers.
Thank you very much for your time.
You're welcome.
Julien Lecachère, Radio-Canada.
Bonjour, Dr Morrison. Ma question suit tout simplement une traduction de ce que vous venez de répondre à Wayne Thibodeau concernant la bulle atlantique. Le nombre de cas augmente sensiblement, notamment au Nouveau-Brunswick. Est-ce que vous pensez toujours que dans 13 jours, le 19 avril, la bulle atlantique ouvrira?
Bonjour Julien. Alors, pour la boule atlantique, je sais que les officiels, les épidémiologistes parlent entre eux dans la région atlantique et ils regardent par jour, par semaine, ce qu'ils veulent voir pour que la boule atlantique pourrait ouvrir dans une façon sécuritaire. Et comme vous avez mentionné, on voit plus de cas en Ontario, au Québec, partout au pays. Et on veut protéger les insulaires, mais la région aussi. Alors, vraiment, je ne sais pas. Je sais qu'il y en a beaucoup qui veulent qu'on ouvre la boule atlantique par le 19 avril pour avoir la chance de voyager sans isolé. Mais il faut qu'on regarde vraiment par jour qu'est-ce qui arrive dans la région. Et aussi, même après la boule, si ça ouvre le 19, si on peut rester dans la boule. J'espère que oui, mais s'il y a quelque chose qui change à l'île du Prince-Édouard ou ailleurs dans la région, on doit changer avec l'évidence. Alors, à ce moment, j'espère que ça va ouvrir, mais je sais qu'on va voir ce qui arrive et si c'est pas quelque chose qu'on pense que c'est le bon moment, on va aviser les premiers ministres.
Pour continuer sur la même question, Dr Morrison, on a parlé en anglais aussi juste avant de la décision de la Nouvelle-Écosse avec Terre-Neuve et Labrador. Est-ce que vous, ça pourrait être aussi une possibilité de vous dire, bien la situation est dangereuse au Nouveau-Brunswick, on n'ouvre pas nos frontières avec le Nouveau-Brunswick, mais on ouvre par exemple nos frontières avec la Nouvelle-Écosse et on se sert uniquement du ferry qui ouvrira le 1er mai. Est-ce que c'est une possibilité pour vous d'ouvrir seulement peut-être une partie d'une bulle atlantique?
Je sais que c'était une question qui était demandée en avant, même peut-être Noël. Est-ce qu'on peut avoir comme un boule partielle? Et je pense que on va y penser, on va y discuter, mais en principe, ça fonctionne mieux quand c'est par région parce que les gens, s'ils vont à Nouvelle-Écosse, ils doivent voyager d'ici la plupart du temps à Nouveau-Brunswick avant d'entrer à Nouvelle-Écosse. Alors, c'est assez difficile vraiment pour les personnes qui travaillent aux frontières de l'île du Prince-Édouard, vraiment, pour faire ces déterminations. Mais on va y parler si on a besoin. Mais on va discuter, bien sûr, si on a besoin.
Merci beaucoup.
Merci.
Dave Stewart, The Guardian.
Good afternoon to you both. I guess my first question would be in relation to the AstraZeneca vaccine. Dr. Morrison, you brought that up during your briefing. And if I heard correctly, it's going to be offered again to Islanders. Is there, judging by, or I guess in connection with previous information and concerns about blood clots, is a person any more likely to suffer a blood clot from the AstraZeneca vaccine than any other medication that people take, birth control being one of them?
So, hi, Dave. So I think the AstraZeneca for those 55 years of age and older, certainly that is National Advisory Committee on Immunization's recommendation, and we know other provinces have sort of limited the use of AstraZeneca to 55 and older because the reports of the VIPID that we talked about last week are not being seen in that particular age cohort. In terms of the birth control and the blood clots, I mean, obviously that's not in that in that particular age group. So we're following that advice, and we have a total of 7,800 doses approximately that have arrived in total that we have in the province of AstraZeneca really over the weekend, and we expect some additional AstraZeneca later in the month, but that will be available for those 55 and over, and so we'll continue to monitor that, and that is already happening in many of the other provinces in the country, the use of AstraZeneca in that particular age cohort.
Thank you very much.
You're welcome.
And I guess my follow-up question would be, I guess, in relation to Easter, yet another weekend in which people tend to gather or want to gather. How long do you think it'll be before we, perhaps see some numbers, or you feel comfortable in the fact that, people kept their circles small on the previous holiday weekend just passed?
So one of the reasons that April 19th was one of the dates for the Atlantic bubble was to allow the provinces a 2-week interval really between Easter and the 19th to see if we saw an increase in cases related to Easter gatherings and some of those connections that happen at that particular time. So usually we would anticipate seeing an increase in cases and symptoms within the next week. But another important reminder, and I think I mentioned it, that if people are having symptoms, one of the ways that we can detect COVID early and then try to minimize spread is if people have symptoms, it's important to go get tested.
Terrific. Thank you very much.
You're welcome.
Louise Martin, CBC.
Hi, and good afternoon to both of you. Dr. Morrison, I know the vaccine rollout is ramping up, and Marion as well, if you want to weigh in on this one. I've just been looking at some of the online appointment schedules, and most clinics are fully booked up until the 1st of May at least, and right now we're in the 60-plus age group. So how is PEI going to meet that end of June timeline for that first dose? Are you expanding to more locations where vaccines could be administered? It seems like an awful lot of vaccines to be going out in a short period of time.
Hi, Louise. So one of the things we've mentioned before, and I think it's hard to reflect that in the appointments. So we will be getting more vaccine into this province in May and in June. So the percentage or the number of vaccines available will be increasing. And so we will be able to book even more people in May and more people in June than we are this week. So that is, and as more vaccine becomes available, we will vaccinate more people. I think we are all we're all in this together. We are all trying to vaccinate as many Islanders with their first dose to protect. We mentioned earlier, to give people good protection. We know that we'll get even better protection with 2 doses, but we will certainly feel better when we get to 1 dose into as many people as possible. So it's as vaccine is due to arrive, there'll be, and we have a good sense of what vaccine is arriving in the province per week. Those vaccine clinics then are adjusted accordingly in terms of numbers, and more people will be able to be vaccinated.
So don't be scared off by seeing that they're sort of full right now until May kind of thing?
That's correct. And so and one of the things we didn't mention was that we did hear that we will get a fairly significant increase in the Pfizer vaccine in June as well. So we don't have the confirmed amount, but based on some initial calculations, maybe another 20,000 doses in June. And if there's some people who are already booked into a vaccine clinic, let's say in 4 weeks from now, and they choose to, as an option, to get AstraZeneca a little bit earlier, then that will also mean that we can book somebody else into that appointment time as well. So that may adjust things a little bit in the next couple weeks.
And with the AstraZeneca, are you worried about reluctance, that people over the age of 55 will be reluctant to get the vaccine given everything that's come about regarding AstraZeneca?
Well, Louise, I think it's a good question. I think there'll be some who may be reluctant, but there'll be others who are really keen to be vaccinated. We know AstraZeneca has been given to millions of people across the world and continues to be administered across the world. So there'll be some who will have an option to get their vaccine earlier if they go with AstraZeneca, and they will. It's one other option. So it'll be interesting to see what happens in the next couple of weeks with AstraZeneca. I think it was the Premier of New Brunswick got his dose of AstraZeneca last week, and many others have as well. So we'll see what the uptake is here, and we'll make adjustments as we need going forward.
Thank you both so much. Have a great day.
Right. Thank you, Louise. Thank you all.